One of the biggest misconceptions I hear from retirees is, if I ever need long-term care, Medicare will take care of it. And unfortunately, that's simply not how Medicare works. Now, Medicare is an excellent healthcare program. It covers many important medical expenses and provides valuable coverage for millions of Americans. But Medicare was never designed to cover ongoing long-term custodial care. And understanding that distinction could have a major impact on your retirement. Hi, I'm Marcus McKinnon. I help people approaching retirement and already retired better understand how retirement income, Medicare, and healthcare decisions work together. Today, I want to talk about something that many families don't think about until they are already facing it: long-term care. Now, when most people hear the words long-term care, they immediately think of a nursing home. But long-term care can mean much more than that. It can mean help at home, help with bathing, getting dressed, meal preparation, transportation, medication reminders, or simply having someone available to help with everyday activities. In fact, most people would prefer to receive care at home if possible. The challenge is that long-term care can be very expensive. Depending on where you live, home health aides can cost thousands of dollars per month. Assisted living can cost several thousand dollars per month. And nursing home care can easily exceed $100,000 per year in many parts of the country. And unfortunately, those costs continue to rise. Think about that for one moment. A retirement plan that looks perfectly fine today can look very different if an individual or a spouse suddenly needs care for 3, 4, or 5 years. And this is where the conversation becomes about more than money, because long-term care doesn't just affect retirement savings, it actually affects family. In fact, I have a client going through this right now. I obviously won't use any names, but over the years, his wife's health has gradually declined. Today, he helps her with many of the things that you and I take for granted. He helps her get to the bathroom. He helps bathe her. He helps get her dressed. And on some days, he even has to help feed her. The thing that always stands out to me is how much he cares for and loves his wife. He's doing everything he can to care for her himself and keep her at home. He's doing everything he can to avoid having to place her in a nursing facility. Because for him, this isn't about the money, it's about his wife. It's about keeping her comfortable. It's about preserving her dignity. And it's about honoring the commitment they've made over the years to one another. Now, they have a son who lives here in Florida. He's in his 30s. He has a wife. He has a young child. He has a career. Like many families, he's trying to balance the responsibilities of his own household while also helping his parents when he can. But the reality is that there may come a point where my client simply can't do it all himself anymore. And if that day comes, he'll be faced with some very difficult decisions. Not because he doesn't want to take care of his wife, quite the opposite, because he loves her deeply. But there are situations where the level of care eventually exceeds what one person can safely provide at home. And that's what many people don't think about when they hear the words long-term care. They think about the cost, but they don't always think about the emotional toll, the physical demand, the stress on a spouse or partner, the impact on children and family members, or the difficult decisions families may face when care needs continue to increase. Now let's go back to Medicare. Medicare may cover certain skilled nursing services under specific circumstances, but that's very different from long-term custodial care. Medicare was never intended to pay for ongoing assistance with everyday activities over an extended period of time. That's where many people are surprised, and it's one of the reasons so many families find themselves unprepared. One statistic that often gets people's attention is that more than 70% of people over age 65 will need some form of long-term care assistance during their lifetime. Yet many retirees have never discussed how they would handle that possibility. Not because they're ignoring it, it's simply not a conversation most people enjoy having. The good news is that planning doesn't necessarily mean buying a specific product. Planning starts with awareness, understanding the risk, understanding the potential impact, and having a plan before a crisis occurs. So if there's one takeaway from this video, it's this. Long-term care isn't just a healthcare issue. It's a retirement issue, it's an income issue, and more often than not, it's a family issue. Understanding what Medicare does and does not cover can help you prepare before decisions become urgent. If you'd like to have a conversation about how long-term care planning fits into your retirement plan, feel free to reach out. No pressure. It really just starts with a simple conversation. You can call or schedule a time, whatever's easiest for you.